look back at this and said, what was it that stopped me from growing from this position to skyrocketing my practice? Because I think that's important in human behaviour. So when I look back at it in hindsight, I thought there's two primary things that stopped me from growing in practice. You may want to write this down. First is a fear. Now, when I was doing this, I had a fear of that I was not good enough, a fear that how can we do this, what are people going to say, how can we stay open day and night, how can I treat patients at 5 o'clock in the morning, what is my profession going to say? Well, when I got past that fear, no one said anything. It was absolutely fine because patients loved it, and we provided a service for patients who couldn't find treatment elsewhere at that time in the morning. And fear is defined as that with your senses you're going to experience more loss than gain, more negative than positive, more challenge than support from someone, something, or yourself. And it's always a future emotion. You can't have a fear of the past. Fear is something that you're always going to have a fear of something in the future. You may have a fear of losing some money. That's a future-orientated emotion. You may have a fear of getting a divorce of someone. That's a future-orientated emotion. Or something, losing a loved one or something. So it's always in the future. So I had to look at my own fears and really confront them and encounter them for me to grow. Am I making any sense? Anybody? By show of hands? Anybody? 1, 2, 2 of you. Great, great. Okay, cool. Second component. The second component which prevented me from growing in practice, again, was guilt. Now, guilt is defined, it's a motor action, and guilt is defined that in the past, you've done something with your motor action which has caused more negative than positive, more challenge than support, more loss than gain to someone, something, or yourself. For example, let me explain that in dental terms. You may have, if you've done root canal treatment, you may have lost 3 millimeters of a file at the end of a tooth, and you think, oh my God, where's this file gone? You take an X-ray and it's there in the tooth, right? One of the things you're not supposed to do. And then that guilt runs you. It runs you for maybe a few minutes, an hour, a day, a week, whatever, and you get kind of constrained by that guilt. Who knows what I'm talking about? Anybody? Yeah, a few hands, right? Great. Thank you for your honesty. So that's a guilt. And in my workshop, my event, which I've got leaflets there for you, I talk about how to dissolve these in practice. I talk about how to be really present with your patient so you're not run by some future guilt. That's dissolved. All you have is thank you, I love you for that. That's it. That doesn't occupy time and space in your mind. And you don't deal with the guilts of the practice, and you dissolve that and say, right, thank you, I love you for whatever that thing is. And you're present, you're powerful, and you're there with your patient. That was the key component in my practice which helped me grow from that level to that level. And they call it the Peter.